My name is Sara Altuna. I'm a medical oncologist from Caracas, Venezuela. I work in the private sector mainly, but I also work with an NGO back home. My work is mainly clinical, so I only see patients in clinical practice, and that's my daily job, and also chemotherapy and treatment overviews and supervision and that kind of stuff. And academic activities, whenever, I'm contacted by scientific societies back home and whenever they're needed.
Excellent, excellent. And can you tell me what you learned over the weekend at ESMO 2023?
Well, I've been entering diverse talks because I see patients with solid tumors, so I have to try to cover all the bases. I wish could have, but it's been really hard because the Congress has been incredible, giving us new science. The presidential symposium yesterday, people with a standing ovation for bladder cancer with enfortumab vedotin. Also, many talks about clinical practice, especially in breast cancer, which is what I see most in my day-to-day practice. I just come from an early triple-negative breast cancer talk, and it's very enlightening to also see that in spite of, the situation and how we're doing things, we're actually doing very well. And so looking at all these trials with all these new drugs, we hopefully will get them soon enough and start implementing clinical practice like Europe and the US are doing. But so far we're doing very well and hope to, solidify the knowledge that we have back home with the information I get here.
Is there any you learned over the weekend that you're going to bring into practice next week?
We don't have it available yet, but the CDK4/6 inhibitors in the adjuvant setting and with early hormone positive breast cancer, and also the triple negative neoadjuvant treatment with early stage like T1B, T1C. We just heard a brilliant talk by Dr. Schmidt, and it was really good. And also monitoring like biomarkers and things like that, like molecular signatures. That's what I like to also specialize in, like molecular biology. So getting testing and getting emphasizing on the need for molecular stratification and testing of patients.
Excellent. Brilliant.
Yeah.
Brilliant. Thank you very much.
You're very welcome.
You use OncoAssist, is that correct?
Every day. I love the app. I don't remember exactly how I found it. I think it was through the App Store or something like that. But I've been using it for years. I don't even remember how long I've been using it. It's been a long time. And I've been happy to see it evolve over time too, because it has very many useful tools and calculators and things like that. I use it to calculate everything, BMI and dosage and things like that. And it's very useful. And also with the adjuvant scores and the treatment guidelines and all these things that have been added recently, those have been nice surprises to see. And also the part with the news and the teaching part of the app is also very helpful. It keeps you on your toes. Whenever you see there's a new notification for, the site of the news and things like that, something relevant has come along, because you get a lot of information, a lot of noise. And so it's really hard to keep up with everything that's coming out. Like in ESMO, it's impossible to keep up one person alone. It's not possible. But when you have it tailored down to what you need, it's much better that way.
Brilliant. Thank you very much.
Thank you so much.
Thanks.
And keep improving the app, please.
Brilliant. We will.
Sure,
We will.
sure.
Thank you.
Thank you.